Medical Assistant Exam Review. Question 1. In a patient intake station, the assistant prepares a vaccine that must remain refrigerated. Which practice is safest? Option A. Use it after expiration if it looks clear. Option B. Store it in a desk drawer overnight. Option C. Maintain required temperature storage and check expiration before use. Option D. Place it in direct sunlight to warm quickly. The correct answer is option C. Maintain required temperature storage and check expiration before use. Vaccines and temperature-sensitive medications require proper storage to preserve effectiveness. Appearance does not prove potency after expiration. Room temperature storage can damage refrigerated products. Sunlight and heat can damage the product. Question 2. In a women's health clinic, a patient falls in the exam room. Which action is best? Option A. Hide the incident if no one saw it. Option B. Pull the patient up immediately. Option C. Call for help and assess for injury before moving the patient. Option D. Tell the patient to drive home without evaluation. The correct answer is option C. Call for help and assess for injury before moving the patient. After a fall, unnecessary movement can worsen injury, so help and assessment come first. Falls must be reported and documented according to policy. Moving the patient before assessment can worsen an injury. The patient should be assessed before leaving. Question 3. Given the workflow in a preventive care visit, the term otitis media is listed in the assessment. Which body area is involved? Option A. Kidney. Option B. Liver. Option C. Middle ear. Option D. Stomach. The correct answer is option C. Middle ear. Otitis media refers to inflammation or infection involving the middle ear. Kidney inflammation is related to nephritis or pyelonephritis. Liver inflammation is hepatitis. Stomach inflammation is gastritis. Question 4. While working in an urgent care office, a patient requests an appointment reminder by text message. Which consideration is important? Option A. Ignore all reminder preferences. Option B. Text any diagnosis to any phone number in the chart. Option C. Follow office policy and patient communication preferences. Option D. Post the reminder on social media. The correct answer is option C. Follow office policy and patient communication preferences. Electronic reminders should follow privacy policy and documented preferences. Preferences help guide appropriate communication. Sensitive information and wrong numbers can create privacy risk. Public posting would expose private information. Question 5. A medical assistant is working in an outpatient laboratory when a fax containing patient information must be sent to another facility. Which step reduces privacy risk? Option A. Include unrelated patient charts in the same fax. Option B. Verify the recipient fax number before sending. Option C. Leave the fax confirmation on a public counter. Option D. Send it to a number from memory without checking. The correct answer is option B. Verify the recipient fax number before sending. Verifying the destination helps prevent disclosure to the wrong recipient. Only necessary information should be disclosed. Confirmation pages may contain protected information and should be handled securely. Memory errors can lead to misdirected protected information. Question 6. To protect safety in a phlebotomy station, a glucose test requiring glycolysis inhibition is ordered. Which tube is commonly associated with this additive purpose? Option A. Lavender tube. Option B. Gray tube. Option C. Blood culture bottle. Option D. Light blue tube. The correct answer is option B. Gray tube. Gray tubes commonly contain additives such as fluoride that help inhibit glycolysis for glucose testing. Lavender EDTA is used mainly for hematology testing. Blood culture bottles are used to detect bloodstream microorganisms. Light blue citrate is used for coagulation studies. Question 7. As part of exam preparation in a busy front office, a patient is left without follow-up after the provider terminates care without proper notice. Which legal issue is most likely? Option A. Beneficence. Option B. Default. Option C. Abandonment. Option D. Coinsurance. The correct answer is option C. Abandonment. Abandonment occurs when care is ended without proper notice or an opportunity to obtain continuing care. Beneficence means acting for the patient's good. Assault is a threat or fear of unwanted touching, not failure to provide follow-up. Coinsurance is a payment-sharing insurance term. Question 8. A medical assistant is working in a patient intake station when a provider orders a capillary blood glucose test. Which site preparation is important? Option A. Clean and dry the puncture site according to protocol. Option B. Puncture through visible dirt. Option C. Skip patient identification because the test is quick. Option D. Use the first visibly dirty drop for every test. The correct answer is option A. Clean and dry the puncture site according to protocol. Cleaning and drying the site reduces contamination and supports accurate capillary testing. Contamination can affect the sample and infection risk. Patient identification is required even for quick point-of-care tests. Site contaminants can affect the first drop depending on protocol. Question 9. During a preventive care visit, a patient must pay a percentage of the allowed charge after the deductible is met. Which term applies? Option A. Remittance address. Option B. Coinsurance. Option C. Copayment. Option D. Referral. The correct answer is option B. Coinsurance. Coinsurance is the patient's percentage share of covered costs. A remittance address tells where payments or documents are sent. A copayment is usually a fixed amount rather than a percentage. A referral is permission or direction to see another provider. Question 10. To protect safety in a women's health clinic, the term dermatology appears in a referral. Which specialty is involved? Option A. Skin. Option B. Heart. Option C. The blood. Option D. Kidney. The correct answer is option A. Skin. Dermatology is the specialty focused on skin conditions. Cardiology focuses on the heart. Hematology focuses on blood and blood disorders. Nephrology focuses on the kidneys. Question 11. An office review in a diagnostic testing area shows that the prefix hyper appears in a term such as hyperglycemia. Which meaning is correct? Option A. Around. Option B. Below normal. Option C. Between. Option D. Above normal or excessive. The correct answer is option D. Above normal or excessive. Hyper means excessive or above normal, as in high blood glucose. Around is indicated by peri. Below normal is indicated by hypo. Between is indicated by inter. Question 12. While working in a patient intake station, a student asks which blood component helps with clotting. Which answer is correct? Option A. Platelets. Option B. Plasma glucose. Option C. Alveoli. Option D. Neurons. The correct answer is option A. Platelets. Platelets help form clots and support hemostasis. Glucose is a blood sugar and does not form clots. Alveoli are lung structures involved in gas exchange. Neurons transmit nerve signals and are not blood clotting cells. Question 13. For a patient encounter in a certification exam scenario, the term dysuria is documented in the chief complaint. Which symptom does it describe? Option A. Painful or difficult urination. Option B. Ear inflammation. Option C. Excessive thirst. Option D. Difficulty swallowing. The correct answer is option A. Painful or difficult urination. Dysuria refers to pain or difficulty with urination. Ear inflammation is otitis. Excessive thirst is polydipsia. Difficulty swallowing is dysphagia. Question 14. When a patient encounter unfolds in a certification exam scenario, a specimen must be protected from light after collection. Which handling method is appropriate? Option A. Shake the specimen vigorously for 1 minute. Option B. Leave the specimen uncovered at the front desk. Option C. Wrap the specimen in foil or use an amber container as directed. Option D. Place the tube in direct sunlight to warm it. The correct answer is option C. Wrap the specimen in foil or use an amber container as directed. Some analytes are light sensitive and require protection immediately after collection. Vigorous shaking can hemolyze blood specimens. Delayed or improper handling can compromise results. Sunlight can degrade light-sensitive specimens. Question 15. For a patient encounter in a medical office workflow, the urinary system is reviewed with a student. Which organ filters blood to form urine? Option A. Kidney. Option B. Gallbladder. Option C. Spleen. Option D. Appendix. The correct answer is option A. Kidney. The kidneys filter blood, regulate fluid balance, and form urine. The gallbladder stores bile and does not form urine. The spleen filters blood cells and supports immune function but does not form urine. The appendix is associated with lymphoid tissue in the digestive tract. Question 16. At the start of care in a women's health clinic, a patient has a red allergy band on the wrist. Which action should occur before medication administration? Option A. Remove the band so it does not worry the patient. Option B. Ignore the band if the patient seems healthy. Option C. Verify the allergy information in the record and with the patient. Option D. Give medication first and ask about allergies later. The correct answer is option C. Verify the allergy information in the record and with the patient. Allergy alerts must be checked before medication administration to prevent reactions. Removing an alert without direction can create risk. Allergy risk is not based on appearance. Allergies must be checked before administration. Question 17. As part of exam preparation in an internal medicine office, soap and water are required instead of alcohol sanitizer after caring for a patient with suspected Clostridioides difficile. Which reason explains this requirement? Option A. Soap and water help remove spores more effectively from the hands. Option B. Hand washing is needed only before eating. Option C. Alcohol sanitizer is always illegal in clinics. Option D. Gloves completely replace hand hygiene. The correct answer is option A. Soap and water help remove spores more effectively from the hands. Certain spores are not reliably eliminated by alcohol-based hand rubs, so mechanical washing is important. Hand hygiene is required at multiple points in patient care. Alcohol-based hand rubs are appropriate for many routine situations. Gloves reduce exposure but do not replace hand hygiene after removal. Question 18. After reviewing the situation in a same-day appointment, an electronic record uses an audit trail. What is its purpose? Option A. Track who accessed or changed information. Option B. Measure blood pressure. Option C. Sterilize instruments automatically. Option D. Approve insurance claims instantly. The correct answer is option A. Track who accessed or changed information. Audit trails support accountability by recording user activity in the record. Vital sign measurement requires clinical equipment and technique. Audit trails do not process instruments. Payer claims processing is separate from record audit logs. Question 19. Before the visit continues in a specialty referral visit, a staff member shares an electronic health record password to save time. Which risk is created? Option A. Better sterilization monitoring. Option B. Loss of accountability for chart access. Option C. Improved privacy protection. Option D. Automatic insurance approval. The correct answer is option B. Loss of accountability for chart access. Unique logins support audit trails and show who accessed or changed information. Login credentials do not sterilize instruments. Password sharing weakens privacy and security. Passwords do not control payer authorization. Question 20. While working in a community health clinic, the assistant prepares instruments for suture removal. Which item is commonly needed? Option A. Ophthalmoscope only. Option B. Tuning fork only. Option C. Peak flow meter only. Option D. Suture removal scissors or sterile scissors according to policy. The correct answer is option D. Suture removal scissors or sterile scissors according to policy. Suture removal requires an appropriate cutting instrument and aseptic supplies according to the procedure. An ophthalmoscope is used to examine the eye, not remove sutures. A tuning fork may be used in hearing or vibration tests. A peak flow meter measures expiratory airflow and does not remove sutures. Question 21. At the start of care in a busy front office, the assistant is checking the electrocardiogram standardization mark. Which setting is commonly expected? Option A. 10 mm per millivolt. Option B. 25 mm per millivolt. Option C. 1 mm per millivolt. Option D. 100 mm per millivolt. The correct answer is option A. 10 mm per millivolt. Standard electrocardiogram calibration is commonly 10 mm per millivolt. That value is not the common standard amplitude calibration. That calibration would make complexes appear too small for standard interpretation. That value would greatly exaggerate waveform size. Question 22. As part of exam preparation in a preventive care visit, the provider mentions the largest artery in the body. Which vessel is being described? Option A. Vena cava. Option B. Aorta. Option C. Pulmonary vein. Option D. Carotid vein. The correct answer is option B. Aorta. The aorta is the main artery carrying blood from the left ventricle to systemic circulation. The vena cava is a large vein returning blood to the heart. Pulmonary veins return blood from the lungs to the heart. Carotid structures are in the neck, but the carotid artery is not the largest artery. Question 23. Given the workflow in a women's health clinic, coordination of benefits is needed. Which situation does this usually involve? Option A. A patient has more than one insurance plan. Option B. A patient needs a sterile dressing. Option C. A patient has one cash payment only. Option D. A provider orders a throat swab. The correct answer is option A. A patient has more than one insurance plan. Coordination of benefits determines how multiple plans share payment responsibility. Dressing supplies do not create coordination of benefits by themselves. One cash payment does not require multiple plan coordination. A throat swab order does not itself involve multiple insurance plans. Question 24. At the start of care in a procedure setup, an intramuscular injection is ordered for an adult. Which site may be used according to protocol? Option A. The fingernail bed. Option B. A reddened rash site. Option C. Deltoid muscle when the medication and volume are appropriate. Option D. Inside a visible vein. The correct answer is option C. Deltoid muscle when the medication and volume are appropriate. The deltoid can be used for certain adult intramuscular injections when volume and medication are suitable. The fingernail bed is not an intramuscular injection site. Irritated or infected skin should generally be avoided. A vein is used for intravenous access, not intramuscular injection. Question 25. Following office protocol in a community health clinic, the assistant is exposed to a needle stick from a used needle. Which action should occur first? Option A. Hide the incident if there is no bleeding. Option B. Wash the area and report the exposure according to protocol. Option C. Finish all remaining patients before telling anyone. Option D. Place a bandage on the site and ignore it. The correct answer is option B. Wash the area and report the exposure according to protocol. Immediate cleansing and prompt reporting start the exposure management process. A needle stick can transmit bloodborne pathogens even with minimal visible injury. Delaying reporting can delay needed evaluation and follow-up. Covering the wound alone does not address exposure risk. Question 26. While working in a certification exam scenario, a wet floor is noticed near the reception desk. Which action best prevents injury? Option A. Place a warning sign and arrange cleanup immediately. Option B. Wait until a patient reports slipping. Option C. Ignore it because it is not in an exam room. Option D. Cover it with loose papers. The correct answer is option A. Place a warning sign and arrange cleanup immediately. Prompt warning and cleanup reduce slip and fall risk. Prevention should occur before an injury happens. Safety hazards matter throughout the facility. Loose paper can worsen slipping and does not clean the hazard. Question 27. The care team in a busy front office asks for guidance because multiple venipuncture tubes are ordered after blood cultures. Which tube should usually come next in the order of draw? Option A. Green heparin tube. Option B. Light blue sodium citrate tube. Option C. Lavender EDTA tube. Option D. Gray fluoride oxalate tube. The correct answer is option B. Light blue sodium citrate tube. After blood cultures, the light blue citrate tube is typically collected early to protect coagulation testing accuracy. Green tubes usually follow serum tubes and do not come immediately after blood cultures in the standard sequence. EDTA tubes are collected later because the additive can contaminate other tubes. Gray tubes are generally collected near the end of the order. Question 28. The care team in a telephone triage workflow asks for guidance because a patient arrives for a routine visit and appears anxious about the first blood pressure reading. Which communication technique should the medical assistant use? Option A. Tell the patient the reading is probably wrong. Option B. Ignore the anxiety to avoid making it worse. Option C. Acknowledge the concern and explain the procedure in simple terms. Option D. Promise that the provider will not be concerned. The correct answer is option C. Acknowledge the concern and explain the procedure in simple terms. Acknowledging emotion and explaining the task supports trust while keeping the patient informed. Dismissing the result can reduce confidence and may be clinically misleading. Ignoring patient concerns can increase anxiety and weaken communication. promising an outcome goes beyond the assistant role and may be inaccurate. Question 29. During a certification exam scenario, the suffix ectomy appears in a procedure term. Which meaning is most accurate? Option A, abnormal softening. Option B, surgical removal. Option C, inflammation. Option D, visual examination. The correct answer is option B, surgical removal. Ectomy means surgical removal of a structure. Abnormal softening is indicated by malacia. Inflammation is indicated by itis. Visual examination is often indicated by scopy. Question 30. During a medical office workflow, a disinfectant label lists a 10-minute wet contact time. Which action is necessary? Option A, keep the surface wet for the full listed contact time. Option B, use the disinfectant only on clean hands. Option C, dilute the solution more to reduce odor. Option D, wipe the surface dry immediately. The correct answer is option A, keep the surface wet for the full listed contact time. Disinfectants need the manufacturer's required contact time to achieve the intended level of microbial kill. Environmental disinfectants are not hand hygiene products. Unapproved dilution can reduce disinfectant strength. Removing the disinfectant too soon can make it ineffective. Question 31. During a quality control review, a patient reports dizziness when standing and the provider requests orthostatic measurements. Which approach is most appropriate? Option A, record the first seated blood pressure as orthostatic. Option B, measure only oxygen saturation while the patient is seated. Option C, measure blood pressure and pulse in different positions according to protocol. Option D, have the patient walk quickly before the measurement. The correct answer is option C, measure blood pressure and pulse in different positions according to protocol. Orthostatic vital signs compare cardiovascular response to position changes. A single seated reading does not show positional change. Oxygen saturation does not assess the blood pressure and pulse changes requested. Exertion can distort the readings and increase fall risk. Question 32. After reviewing the situation in a treatment room, lead V4 is being placed for a standard 12-lead electrocardiogram. Which location is correct? Option A, fourth intercostal space at the right sternal border. Option B, midway between V2 and V4. Option C, fifth intercostal space at the left midclavicular line. Option D, a fourth intercostal space at the left sternal border. The correct answer is option C, fifth intercostal space at the left midclavicular line. V4 is placed at the fifth intercostal space along the left midclavicular line. That location is used for V1. That location is used for V3 rather than V4. That location is used for V2. Question 33. At the start of care in a preventive care visit, a reagent bottle is past its expiration date. Which action is appropriate? Option A, do not use it for patient testing. Option B, use it only for abnormal patients. Option C, change the expiration date on the label. Option D, mix it with a new reagent to strengthen it. The correct answer is option A, do not use it for patient testing. Expired reagents can produce inaccurate results and should be handled according to policy. Expired reagents are not reliable for any patient testing. Altering dates is unsafe and unethical. Mixing reagents without approval can invalidate testing. Question 34. The care team in a same-day appointment asks for guidance because a mistake is found in an electronic progress note after it was signed. Which correction method is appropriate? Option A, make an addendum according to office policy. Option B, ask a coworker to change it under their login. Option C, delete the original note completely. Option D, ignore the error even if it affects care. The correct answer is option A, make an addendum according to office policy. An addendum preserves the original entry while documenting the correction transparently. Using another person's login violates accountability. Deleting a signed record can destroy the audit trail. Clinically important errors should be corrected through proper procedures. Question 35. For a patient encounter in a procedure setup, blood spills on an exam room floor. Which response follows standard safety practice? Option A, wipe the spill with a dry paper towel only. Option B, ask a patient to avoid stepping on it. Option C, cover the spill with an exam table paper. Option D, use appropriate personal protective equipment and an approved disinfectant. The correct answer is option D, Use appropriate personal protective equipment and an approved disinfectant. Blood spills require barrier protection and a disinfectant suitable for bloodborne pathogen cleanup. Dry wiping can spread contamination and does not disinfect the surface. Patients should not be involved in hazardous cleanup. Covering a spill does not remove or disinfect the hazard. Question 36. The care team in an administrative check-in area asks for guidance because a multi-dose vial has no date after being opened. Which action is most appropriate? Option A. Use it because the cap is still attached. Option B. Follow facility policy and do not use it if safety cannot be verified. Option C. Guess the opening date from memory. Option D. Mix it with another vial to avoid waste. The correct answer is option B. Follow facility policy and do not use it if safety cannot be verified. Opened multi-dose vials require proper dating and storage to support medication safety. The cap does not prove when the vial was opened or whether it was stored correctly. Guessing creates unsafe documentation. Combining vials can contaminate medication and is not appropriate. Question 37. An office review in a same-day appointment shows that a vial contains 100 mg per milliliter and the order is 50 mg. Which volume should be prepared? Option A, 10 milliliters. Option B, 1 milliliter. Option C, 5 milliliters. Option D, 0.5 milliliter. The correct answer is option D, 0.5 milliliter. Dividing the ordered dose by the available concentration gives 50 divided by 100, which equals 0.5 milliliter. 10 milliliters would provide 1000 milligrams and is far above the ordered dose. 1 milliliter would provide 100 milligrams. 5 milliliters would provide 500 milligrams at this concentration. Question 38. Before the visit continues in a pediatric clinic, a patient arrives at check-in and the waiting room can overhear the conversation. Which practice protects privacy? Option A. Ask other patients to help verify the record. Option B. Place all charts open on the counter. Option C. Speak quietly and avoid announcing sensitive details. Option D. State the full diagnosis loudly to confirm the visit. The correct answer is option C. Speak quietly and avoid announcing sensitive details. Front office privacy requires limiting unnecessary disclosure where others may overhear. Other patients should not be involved in private verification. Open charts may expose protected information. Announcing diagnoses in public can violate confidentiality. Question 39. While working in a community health clinic, a patient with diabetes is scheduled for fasting laboratory work. Which action is appropriate? Option A. Tell the patient to stop all diabetes medications without provider input. Option B. Cancel the test because diabetes always prevents fasting labs. Option C. Tell the patient fasting means no restrictions at all. Option D. Review fasting instructions and route medication questions to the provider. The correct answer is option D. Review fasting instructions and route medication questions to the provider. Fasting instructions can be reinforced, while medication adjustments require provider guidance. Medication changes can be unsafe without provider direction. Diabetes requires careful instructions but does not automatically cancel testing. Fasting usually includes specific limits on food and drink. Question 40. After reviewing the situation in a certification exam scenario, a standard electrocardiogram is ordered for a patient with lotion on the chest. Which action improves electrode adhesion? Option A. Apply electrodes directly over lotion. Option B. Move all chest leads to the abdomen. Option C. Use tape only and skip electrodes. Option D. Clean and dry the skin before applying electrodes. The correct answer is option D. Clean and dry the skin before applying electrodes. Oil or lotion can prevent proper electrode contact and should be removed according to protocol. Poor adhesion can cause artifact or lead loss. Incorrect lead placement changes the tracing and may impair interpretation. Tape cannot record cardiac electrical activity. Question 41. An office review in a family practice clinic shows that a used needle must be discarded after an injection. Which practice is safest? Option A. Place the needle in regular trash. Option B. Recap the needle with both hands. Option C. Carry the needle to the front desk for disposal. Option D. Activate the safety device and place the needle in a sharps container. The correct answer is option D. Activate the safety device and place the needle in a sharps container. Sharps should be secured and discarded immediately in a puncture-resistant sharps container. Sharps can injure staff and must not go into regular trash. Two-handed recapping increases needle stick risk. Transporting exposed sharps through the office increases risk. Question 42. A medical assistant is working in a pediatric clinic when a patient receives a document explaining what the insurer paid and what may be owed. Which document is this? Option A, Advance Directive. Option B, Sterilization Log. Option C, Progress Note. Option D, Explanation of Benefits. The correct answer is option D, Explanation of Benefits. An explanation of benefits summarizes payer processing, allowed amounts, payments, and patient responsibility. An advance directive communicates future care wishes, not payment information. A sterilization log tracks instrument processing, not claim payment. A progress note documents clinical care, not insurance payment decisions. Question 43. An office review in an administrative check-in area shows that a manual blood pressure cuff is too small for the patient's arm. Which result is most likely? Option A. The blood pressure may read falsely low. Option B. The pulse oximetry reading will be inaccurate. Option C. The blood pressure may read falsely high. Option D. The temperature will be elevated. The correct answer is option C. The blood pressure may read falsely high. A cuff that is too small can overestimate blood pressure because pressure is applied over too narrow an area. A cuff that is too large is more likely to produce a falsely low reading. Cuff size does not directly determine oxygen saturation accuracy. Cuff size has no direct effect on body temperature. Question 44. As part of exam preparation in an exam room, the assistant uses a fire extinguisher on a small contained fire. Which acronym describes extinguisher use? Option A, PASS. Option B, ERICE. Option C, PERLA. Option D, HIPAA. The correct answer is option A, PASS. PASS stands for pull, aim, squeeze, and sweep. RICE refers to rest, ice, compression, and elevation for certain injuries. PERLA describes pupil assessment. HIPAA governs health information privacy and security. Question 45. For a patient encounter in a patient education session, a medical assistant performs a procedure without patient permission. Which legal concern may apply? Option A, emancipation. Option B, coordination of benefits. Option C, battery. Option D, defamation. The correct answer is option C, battery. Battery can involve intentional touching or treatment without consent. Emancipation relates to a minor's legal independence. Coordination of benefits is an insurance concept. Defamation involves false statements that harm reputation. Question 46. When a patient encounter unfolds in a pediatric clinic, a patient calls with chest pain and shortness of breath. Which scheduling action is most appropriate? Option A, tell the patient to send an email later. Option B, give a diagnosis over the phone. Option C, follow emergency triage protocol immediately. Option D, schedule the patient for next month. The correct answer is option C, follow emergency triage protocol immediately. Potential emergency symptoms should be handled urgently according to office protocol rather than scheduled as routine. Potential emergencies require immediate action. Medical assistants should not diagnose the cause of symptoms. Routine scheduling can delay care for potentially serious symptoms. Question 47. Given the workflow in a procedure setup, the assistant scans a signed consent form into the wrong patient's chart. Which action is best? Option A, ask the patient to sign a blank form. Option B, report and correct the filing error according to policy. Option C, leave it because both patients use the same clinic. Option D, delete the form and tell no one. The correct answer is option B, report and correct the filing error according to policy. Misfiled records can affect patient care and privacy, so they must be corrected properly. Blank forms do not correct the misfiled record and are inappropriate. Clinic use does not make one patient's document appropriate in another chart. Unreported deletion can worsen the documentation error. Question 48. When a patient encounter unfolds in a telephone triage workflow, the term bradycardia appears in the chart. Which meaning should the medical assistant recognize? Option A, inflammation of the liver. Option B, high blood sugar. Option C, slow heart rate. Option D, fast breathing. The correct answer is option C, Slow heart rate. The prefix brady means slow, and cardia refers to the heart. Inflammation of the liver is hepatitis. High blood sugar is hyperglycemia. Fast breathing is tachypnea rather than bradycardia. Question 49. An office review in a cardiology practice shows that a patient is crying after receiving difficult news from the provider. Which nonverbal behavior is supportive? Option A. Laugh to lighten the mood immediately. Option B. Keep checking messages during the conversation. Option C. Sit at eye level and allow silence when appropriate. Option D. Stand over the patient with crossed arms. The correct answer is option C. Sit at eye level and allow silence when appropriate. Calm presence, appropriate eye level, and respectful silence can support a distressed patient. Humor can be inappropriate when a patient is distressed. Distracted behavior suggests the patient is not being heard. Closed posture and standing over the patient can seem intimidating. Question 50. After reviewing the situation in a treatment room, a patient has confirmed influenza and is coughing in the waiting room. Which infection control step is most appropriate? Option A. Skip precautions if the patient is already taking medication. Option B. Apply droplet precautions and offer a mask according to protocol. Option C. Use only sterile gloves without a mask. Option D. Place the patient beside an immunocompromised patient. The correct answer is option B. Apply droplet precautions and offer a mask according to protocol. Influenza is commonly managed with droplet precautions and source control measures. Treatment does not remove the need for appropriate precautions. Sterile gloves do not protect mucous membranes from respiratory droplets. Separating symptomatic patients helps reduce transmission risk. Question 51. At the start of care in a walk-in clinic, an assistant is unsure how to handle a chemical disinfectant spill. Which resource should be consulted? Option A. Patient intake form. Option B. Safety data sheet. Option C. Insurance remittance advice. Option D. Appointment reminder template. The correct answer is option B. Safety data sheet. The safety data sheet gives hazard, handling, storage, and spill response information for chemicals. An intake form does not provide chemical safety instructions. Remittance advice explains payment decisions, not chemical hazards. Reminder templates do not address workplace chemical safety. Question 52. Before the visit continues in a phlebotomy station, a patient has a minor nosebleed while waiting. Which first aid instruction is commonly appropriate? Option A. Tilt the head far backward. Option B. Pack the nose with contaminated gauze. Option C. Lie flat immediately without assessment. Option D. Sit upright and lean slightly forward. The correct answer is option D. Sit upright and lean slightly forward. Leaning forward helps reduce swallowing blood while upright posture can reduce pressure. Tilting backward can cause blood to drain into the throat. Contaminated materials should not be inserted into the nose. Lying flat can increase swallowing of blood and is not the usual first step for a simple nosebleed. Question 53. The care team in a same-day appointment asks for guidance because the assistant reinforces instructions for a Holter monitor. Which point is important? Option A. Keep a diary of symptoms and activities as instructed. Option B. Remove electrodes whenever symptoms occur. Option C. Ignore the return time. Option D. Submerge the monitor in water. The correct answer is option A. Keep a diary of symptoms and activities as instructed. A symptom and activity diary helps correlate events with the recorded rhythm. Removing electrodes can interrupt recording when data are most important. The monitor must be returned as scheduled for data review. Water can damage the device and create safety risks. Question 54. At the start of care in a primary care office, a tickler file is used in the office. Which purpose does it serve? Option A. Sterilize instruments. Option B. Measure oxygen saturation. Option C. Draw blood into tubes. Option D. Track future follow-ups or reminders. The correct answer is option D. Track future follow-ups or reminders. A tickler system helps staff remember time-sensitive tasks or future actions. Sterilization requires approved equipment and process. Oxygen saturation requires a pulse oximeter. Blood collection uses phlebotomy supplies, not a reminder file. Question 55. Given the workflow in a certification exam scenario, a subpoena for medical records arrives at the office. Which response is best? Option A. Give it to the provider or designated privacy officer for proper handling. Option B. Immediately fax the entire chart without review. Option C. Ignore it because subpoenas never apply to clinics. Option D. Ask the receptionist to summarize the chart from memory. The correct answer is option A. Give it to the provider or designated privacy officer for proper handling. Legal requests for records should be reviewed through office policy before information is released. Records should not be released without verifying legal requirements and scope. Subpoenas can require action and should not be ignored. Summaries from memory are unreliable and not an appropriate legal response. Question 56. After reviewing the situation in a medication administration visit, the assistant teaches a patient how to prepare for a fasting laboratory test. Which method best confirms understanding? Option A. Use medical jargon to sound professional. Option B. Ask only whether the patient has any questions. Option C. Give instructions as quickly as possible. Option D. Ask the patient to explain the instructions back in their own words. The correct answer is option D. Ask the patient to explain the instructions back in their own words. Teach back checks whether the patient understood the instructions and allows correction of misunderstandings. Jargon can confuse patients and reduce understanding. Patients may say no even when they misunderstand instructions. Rushing can reduce comprehension. Question 57. During a diagnostic testing area, a complete blood count is ordered. Which tube is most commonly used? Option A. Red tube with no anticoagulant. Option B. Lavender tube with EDTA. Option C. Gray tube with fluoride oxalate. Option D. Light blue tube with sodium citrate. The correct answer is option B. Lavender tube with EDTA. A complete blood count requires anticoagulated whole blood, and EDTA in a lavender tube preserves cell morphology. A red tube allows clotting and is not the standard choice for a complete blood count. Gray tubes are used for tests such as glucose or lactate depending on protocol. Sodium citrate is used mainly for coagulation studies. Question 58. After reviewing the situation in an outpatient laboratory, a waived glucose meter control result is outside the acceptable range. Which action is required before patient testing? Option A. Change the patient's diagnosis to match the meter. Option B. Resolve the quality control problem according to protocol. Option C. Record patient results without documenting controls. Option D. Use the meter because patient samples are different. The correct answer is option B. Resolve the quality control problem according to protocol. Out-of-range controls mean the system may not be reliable for patient results. Medical assistants do not diagnose and should not alter clinical information to fit a device. Quality control documentation is part of reliable testing. Failed controls must be addressed before reporting patient values. Question 59. Before the visit continues in a medication administration visit, a blood specimen must be mixed with additive after collection. Which technique is appropriate? Option A. Shake the tube forcefully. Option B. Leave the tube unmixed until pickup. Option C. Open the tube and stir with a swab. Option D. Gently invert the tube the required number of times. The correct answer is option D. Gently invert the tube the required number of times. Gentle inversion mixes blood with additive without causing unnecessary cell damage. Forceful shaking can cause hemolysis and inaccurate results. Failure to mix may cause clotting or poor specimen quality. Opening the tube can contaminate the specimen and expose staph. Question 60. Before the visit continues in a diagnostic testing area, a patient with known latex allergy is scheduled for a procedure. Which preparation is best? Option A. Ignore the allergy if the procedure is short. Option B. Tell the patient to bring personal gloves only. Option C. Use latex-free supplies and clearly communicate the allergy. Option D. Use powdered latex gloves because they are easier to put on. The correct answer is option C. Use latex-free supplies and clearly communicate the allergy. Avoiding latex exposure prevents allergic reactions and keeps the team aware of the risk. Even brief latex exposure can cause a serious reaction. The clinic remains responsible for preparing a safe care environment. Latex gloves can trigger a reaction in a latex allergic patient. Question 61. When a patient encounter unfolds in an urgent care office, an exam room was used for a patient with a draining wound. Which step should be completed before the next patient enters? Option A, clean and disinfect touched surfaces according to office protocol. Option B, spray disinfectant and wipe it off immediately every time. Option C, open the door to air out the room only. Option D, change only the paper on the exam table. The correct answer is option A, clean and disinfect touched surfaces according to office protocol. Environmental cleaning reduces the chance of transferring microorganisms between patients. Disinfectants usually require the manufacturer's contact time to work properly. Ventilation alone does not remove organisms from contaminated surfaces. The exam table paper does not address other touched surfaces. Question 62. Following office protocol in an electronic health record review, the assistant reviews the normal pacemaker of the heart. Which structure is identified? Option A, alveolus. Option B, gallbladder. Option C, ureter. Option D, sinoatrial node. The correct answer is option D, sinoatrial node. The sinoatrial node normally initiates the heart's electrical impulse. An alveolus is a lung air sac. The gallbladder stores bile and is not cardiac conduction tissue. A ureter carries urine from kidney to bladder. Question 63. An office review in a telephone triage workflow shows that the P wave is reviewed on an electrocardiogram. Which event does it represent? Option A, atrial depolarization. Option B, ventricular repolarization. Option C, kidney filtration. Option D, ventricular depolarization. The correct answer is option A, atrial depolarization. The P wave represents electrical activation of the atria. Ventricular repolarization is represented by the T wave. Kidney filtration is unrelated to electrocardiogram waveforms. Ventricular depolarization is represented mainly by the QRS complex. Question 64. As part of exam preparation in a busy front office, the provider discusses the function of white blood cells. Which role is most accurate? Option A, help defend against infection. Option B, carry oxygen as their primary job. Option C, produce insulin in the pancreas. Option D, store bile for digestion. The correct answer is option A, help defend against infection. White blood cells are immune cells that help protect the body from infection. Oxygen transport is mainly the role of red blood cells. Insulin production occurs in pancreatic beta cells, not white blood cells. Bile storage is a gallbladder function. Question 65. Before the visit continues in an administrative check-in area, a pregnancy test performed in the office is classified as waived testing. Which requirement still applies? Option A, use expired kits if the package is unopened. Option B, skip controls because waived means unregulated. Option C, report results before the test develops. Option D, follow manufacturer instructions and quality control policy. The correct answer is option D, follow manufacturer instructions and quality control policy. Waived tests are simple, but they still require correct procedure, controls, and documentation. Expired test kits may give unreliable results. Waived status does not eliminate quality responsibilities. Reading before the correct time can produce inaccurate results. Question 66. Given the workflow in a community health clinic, the assistant is comparing two needle gauges. Which statement is accurate? Option A, all injections use the same gauge. Option B, a larger gauge number always means a longer needle. Option C, a smaller gauge number indicates a larger needle diameter. Option D, gauge has no relation to needle size. The correct answer is option C, a smaller gauge number indicates a larger needle diameter. Needle gauge numbers are inverse to diameter, so lower numbers are wider. Needle gauge varies by medication, route, and patient factors. Gauge describes diameter, not length. Gauge specifically describes needle diameter. Question 67. At the start of care in a primary care office, a new patient calls to schedule an annual physical. Which information should be collected for registration? Option A, demographics, contact information, insurance information, and reason for visit. Option B, another patient's insurance card. Option C, only the patient's favorite pharmacy color. Option D, the assistant's diagnosis before the visit. The correct answer is option A, demographics, contact information, insurance information, and reason for visit. Complete registration information supports scheduling, billing, and clinical preparation. Insurance information must belong to the patient being registered. That information does not complete registration. The assistant should not diagnose during scheduling. Question 68. At the start of care in a diagnostic testing area, a provider documents a vaccine administration. Which coding information may be needed for billing? Option A. Only the assistant's initials with no service information. Option B. Only the patient's favorite color. Option C. Procedure code and diagnosis or reason for the service. Option D. Only the room number. The correct answer is option C. Procedure code and diagnosis or reason for the service. Claims often require a service code and a diagnosis or reason to support medical necessity. Initials alone do not provide billing codes or medical necessity. Personal preferences do not support claim coding. Room numbers do not describe the service or diagnosis. Question 69. A medical assistant is working in a certification exam scenario when the assistant speaks with a patient who has hearing difficulty. Which approach is best? Option A. Assume the patient cannot participate. Option B. Cover the mouth while speaking. Option C. Shout from another room. Option D. Face the patient and speak clearly at a moderate pace. The correct answer is option D. Face the patient and speak clearly at a moderate pace. Facing the patient supports lip reading and clear communication without shouting. Hearing difficulty does not mean the patient cannot understand or decide. Covering the mouth removes visual cues. Shouting from a distance reduces clarity and privacy. Question 70. In a patient intake station, lead V1 is being placed for a standard 12-lead electrocardiogram. Which location is correct? Option A. Fourth intercostal space at the left sternal border. Option B. Fourth intercostal space at the right sternal border. Option C. Fifth intercostal space at the left midclavicular line. Option D. Left arm below the clavicle. The correct answer is option B. Fourth intercostal space at the right sternal border. V1 belongs at the fourth intercostal space on the right side of the sternum. That location corresponds to V2. That location corresponds to V4 in standard placement. The left arm electrode is a limb lead site, not V1. Question 71. Given the workflow in a treatment room, a medical assistant is preparing a sterile field. Which action would contaminate the field? Option A. Opening the wrapper away from the body first. Option B. Keeping sterile items above waist level. Option C. Reaching across the sterile field with an unsterile sleeve. Option D. Using sterile forceps for sterile supplies. The correct answer is option C. Reaching across the sterile field with an unsterile sleeve. Crossing a sterile field with unsterile clothing can contaminate the field. Opening the far flap first is a common way to avoid reaching over the field. Sterile items are generally kept in view and above waist level. Sterile forceps can help maintain asepsis when used correctly. Question 72. While working in a family practice clinic, a patient has an advance directive in the chart. Which statement is most accurate? Option A. It is used only to schedule appointments. Option B. It replaces all insurance forms. Option C. It communicates the patient's wishes about future medical care. Option D. It allows the assistant to ignore provider orders. The correct answer is option C. It communicates the patient's wishes about future medical care. An advance directive helps guide care decisions if the patient cannot speak for themselves. Scheduling is unrelated to the purpose of an advance directive. Advance directives do not replace billing or insurance documents. Care decisions still follow legal, clinical, and facility processes. Question 73. Given the workflow in a walk-in clinic, the term nephrology appears in a referral. Which specialty is involved? Option A. Ears. Option B. Bones. Option C. Kidneys. Option D. Eyes. The correct answer is option C. Kidneys. Nephrology is the specialty focused on kidney function and disease. Otolaryngology focuses on ear, nose, and throat conditions. Orthopedics focuses on the musculoskeletal system. Ophthalmology focuses on eyes. Question 74. At the start of care in a specialty referral visit, the prefix hypo appears in a term such as hypoglycemia. Which meaning is correct? Option A. Against. Option B. Below normal or deficient. Option C. Before. Option D. Above normal. The correct answer is option B. Below normal or deficient. Hypo means below normal or deficient, as in low blood glucose. Against is indicated by anti. Before is indicated by pre, above normal is indicated by hyper. Question 75. After reviewing the situation in a busy front office, a patient questions a medication that looks different from the usual dose. Which response is safest? Option A, document that the patient was difficult and continue. Option B, tell the patient that questions are not allowed. Option C, pause administration and verify the order and medication. Option D, give the medication quickly before the patient refuses. The correct answer is option C, pause administration and verify the order and medication. A patient concern can identify a potential medication error, so verification is required before proceeding. Labeling the patient does not resolve the possible medication issue. Patients should be encouraged to participate in safety. Rushing increases risk and ignores a safety concern. Question 76. In a treatment room, a medication is labeled for otic use. Where should it be administered? Option A, ear. Option B, nose. Option C, eye. Option D, mouth. The correct answer is option A, ear. Otic medications are intended for the ear. Nasal medications are administered through the nose. Eye medications are ophthalmic, not otic. Oral medications are taken by mouth. Question 77. While working in a cardiology practice, the patient asks why they must lie still during an electrocardiogram. Which explanation is best? Option A, movement can create artifact that makes the tracing harder to interpret. Option B, movement changes the patient's blood type. Option C, electrodes are used only to deliver medication. Option D, the machine cannot record any heartbeat unless the patient holds breath for 5 minutes. The correct answer is option A. Movement can create artifact that makes the tracing harder to interpret. Stillness improves the quality of the electrical recording. Movement has no effect on blood type. Electrodes detect electrical activity and do not deliver medication during a standard recording. Normal breathing is usually allowed, but excessive movement should be avoided. Question 78. While working in a certification exam scenario, a patient asks why a medication is placed under the tongue. Which route is being described? Option A, ophthalmic. Option B, otic. Option C, topical. Option D, sublingual. The correct answer is option D, sublingual. Sublingual administration places medication under the tongue for absorption through oral mucosa. Ophthalmic medications are used in the eye. Otic medications are placed in the ear. Topical medications are applied to the skin or surface tissues. Question 79. To protect safety in an internal medicine office, a coworker asks to view a neighbor's chart out of curiosity. Which response is appropriate? Option A, print the chart and remove the patient's name only. Option B, open the chart if the coworker promises not to tell anyone. Option C, deny the request because there is no job-related need to know. Option D, share the chart because staff work in the same clinic. The correct answer is option C, deny the request because there is no job-related need to know. Access to protected health information must be limited to legitimate work-related purposes. De-identified information must meet specific standards and curiosity is not permitted access. A promise does not create a permitted reason for access. Employment at the same clinic does not automatically authorize chart access. Question 80. Given the workflow in a medication administration visit, a pain score is being collected during intake. Which approach is best? Option A, assume pain level from facial expression only. Option B, change the score to match the assistant's opinion. Option C, ask the patient to rate pain using the office's standard scale. Option D, tell the patient pain is not part of vital signs. The correct answer is option C, ask the patient to rate pain using the office's standard scale. Using a consistent pain scale helps document subjective pain in a comparable way. Facial expression alone may not reflect the patient's reported pain. The pain score should reflect the patient's report. Pain assessment is commonly included in intake workflows. Question 81. Before the visit continues in a patient intake station, a patient with limited English proficiency arrives for a consent discussion. Which resource is most appropriate? Option A, use a qualified medical interpreter. Option B, skip the explanation if the patient nods. Option C, speak louder and slower in English only. Option D, ask a young child to interpret. The correct answer is option A, use a qualified medical interpreter. A qualified interpreter improves accuracy, confidentiality, and informed communication. Nodding does not prove understanding or valid communication. Volume does not remove a language barrier. Children should not be used for medical interpretation because accuracy and family dynamics are concerns. Question 82. In a telephone triage workflow, the provider asks the assistant to perform a task prohibited by state law. Which action is appropriate? Option A. Document that the patient requested it and proceed. Option B. Perform it because any provider request is automatically legal. Option C. Clarify the concern and follow legal scope of practice requirements. Option D. Ask another assistant to do it secretly. The correct answer is option C. Clarify the concern and follow legal scope of practice requirements. Medical assistants must follow laws, regulations, and employer policy even when working under delegation. Patient request does not override scope of practice limits. Delegation does not make a prohibited task legal. Passing on an improper task does not resolve the legal issue. Question 83. For a patient encounter in an electronic health record review, a patient has chest hair that prevents electrodes from adhering. Which action is most appropriate? Option A. Place electrodes over clothing. Option B. Prepare the skin according to protocol to improve electrode contact. Option C. Wet the electrodes with tap water only. Option D. Ignore loose electrodes if the tracing prints. The correct answer is option B. Prepare the skin according to protocol to improve electrode contact. Good skin preparation helps electrodes adhere and improves tracing quality. Electrodes must contact skin to record electrical activity. Unapproved moisture does not replace proper skin preparation. Loose electrodes can create artifact and poor quality results. Question 84. In a patient intake station, the assistant removes gloves after contact with blood-contaminated gauze. Which action should follow immediately? Option A. Place the gloves in a regular drawer. Option B. Use the same gloves to clean the next room. Option C. Perform hand hygiene. Option D. Apply lotion instead of cleaning hands. The correct answer is option C. Perform hand hygiene. Hand hygiene after glove removal reduces the chance of transmitting microorganisms from contaminated gloves. Used gloves are contaminated waste and should be discarded properly. Gloves are task-specific and should not be reused between patients or areas. Lotion does not replace hand hygiene. Question 85. Given the workflow in a certification exam scenario, a peak flow test is ordered. Which body system is being assessed? Option A. Skeletal system only. Option B. Urinary system. Option C. Integumentary system. Option D. Respiratory system. The correct answer is option D. Respiratory system. Peak flow measures how quickly air can be exhaled and is related to respiratory function. Peak flow does not measure bone structure. The urinary system is assessed with urine tests and related procedures. The integumentary system involves the skin, hair, and nails. Question 86. Following office protocol in a procedure setup, the assistant documents a patient's statement in the medical record. Which entry is most appropriate? Option A. Patient states, "I have had a cough for 3 days." Option B. Patient is definitely exaggerating the cough. Option C. The assistant diagnoses pneumonia. Option D. No documentation is needed for symptoms. The correct answer is option A. Patient states, "I have had a cough for 3 days." Quoting or clearly attributing patient statements helps distinguish subjective information from clinical findings. Judgmental wording is inappropriate and not objective. Diagnosis belongs to the provider. Symptoms are relevant to the visit and should be documented according to policy. Question 87. After reviewing the situation in a medical office workflow, a claim requires the code that explains why a service was performed. Which code set is used? Option A. Place of service only. Option B. NDC only. Option C. CPT. Option D. ICD-10-CM. The correct answer is option D. ICD-10-CM. ICD-10-CM codes report diagnoses and reasons for services. Place of service identifies setting, not the medical reason for care. National drug codes identify medications and do not describe diagnoses. CPT codes report procedures and services rather than diagnoses. Question 88. For a patient encounter in a pediatric clinic, A new patient completes a health history form with several medication allergies listed. Which action should the medical assistant take next? Option A, remove allergies that the patient says happened many years ago. Option B, place the form in the chart without reviewing it. Option C, verify the allergy information and enter it clearly in the medical record. Option D, ask the patient to remember only prescription allergies. The correct answer is option C. Verify the allergy information and enter it clearly in the medical record. Medication allergies must be confirmed and documented so the care team can avoid unsafe orders. Past reactions may still be clinically important and should not be deleted without provider direction. Important safety information can be missed if the history is not reviewed. Allergies to over-the-counter drugs, foods, or latex may also affect care. Question 89. Following office protocol in an administrative check-in area, a patient becomes angry about a long wait time. Which response is most appropriate? Option A, acknowledge the frustration and provide a realistic update. Option B, tell the patient to calm down or leave. Option C, ignore the patient until the appointment starts. Option D, blame the provider in front of the patient. The correct answer is option A. Acknowledge the frustration and provide a realistic update. Empathy and accurate information can de-escalate frustration while maintaining professionalism. Commands can escalate conflict and harm patient rapport. Ignoring frustration often makes the situation worse. Blaming coworkers is unprofessional and does not solve the issue. Question 90. A medical assistant is working in a family practice clinic when the term gastroenterology appears in a referral. Which specialty is involved? Option A, endocrine glands. Option B, digestive system. Option C, nervous system. Option D, urinary bladder only. The correct answer is option B, digestive system. Gastroenterology focuses on the digestive tract and related disorders. Endocrinology focuses on hormone-producing glands. Neurology focuses on the nervous system. Urology focuses on the urinary tract and male reproductive system. Question 91. A medical assistant is working in an internal medicine office when a patient has been drinking hot coffee immediately before an oral temperature. Which action should the medical assistant take? Option A, record the temperature as normal without measuring it. Option B, switch to a rectal temperature without asking. Option C, wait according to office protocol before measuring the oral temperature. Option D, take the temperature immediately because oral readings are unaffected. The correct answer is option C. Wait according to office protocol before measuring the oral temperature. Hot or cold intake can temporarily alter oral temperature and lead to an inaccurate reading. Vital signs must be measured rather than assumed. Changing to an invasive route requires proper indication and protocol. Recent liquids can affect oral temperature results. Question 92. During a same-day appointment, a patient collapses in the hallway and is unresponsive. Which action should be taken first? Option A, offer water by mouth immediately. Option B, finish documenting the previous visit. Option C, activate emergency response and assess breathing according to training. Option D, move the patient to a chair before assessing. The correct answer is option C. Activate emergency response and assess breathing according to training. An unresponsive patient requires immediate emergency response and basic life support actions within training. Giving oral fluids to an unresponsive patient risks aspiration. Documentation should not delay emergency care. Unnecessary movement can cause injury and delay assessment. Question 93. For a patient encounter in a family practice clinic, a patient feels faint during a blood draw. Which response should occur first? Option A, leave the patient alone to find paperwork. Option B, finish filling the tube before responding. Option C, stop the procedure and protect the patient from injury. Option D, tell the patient to stand up quickly. The correct answer is option C. Stop the procedure and protect the patient from injury. Safety comes first when a patient shows signs of syncope during venipuncture. A faint patient should not be left unattended. Continuing the draw can worsen the situation and increase injury risk. Standing can worsen faintness and lead to a fall. Question 94. When a patient encounter unfolds in a medication administration visit, office supplies are consistently running out before the next order date. Which administrative action is best? Option A, hide supplies from the provider. Option B, order random supplies without reviewing use. Option C, track usage and adjust par levels according to office needs. Option D, wait until every item is completely gone. The correct answer is option C, track usage and adjust par levels according to office needs. Inventory control uses usage patterns and reorder points to prevent shortages. Hiding supplies does not solve inventory management. Unplanned ordering can waste money and storage space. Waiting can interrupt patient care and office workflow. Question 95. When a patient encounter unfolds in an infection control audit, an adult patient has a blood pressure reading much higher than previous visits. Which action should the medical assistant take? Option A, recheck using proper technique and report the finding according to protocol. Option B, erase the value because it may worry the patient. Option C, tell the patient that hypertension has been diagnosed. Option D, send the patient home to rest without notifying anyone. The correct answer is option A, recheck using proper technique and report the finding according to protocol. Unexpected or significantly abnormal vital signs should be verified and communicated to the provider. Accurate documentation is required even when the value is abnormal. Medical assistants do not diagnose conditions based on one reading. Abnormal readings require appropriate follow-up rather than dismissal. Question 96. Before the visit continues in a family practice clinic, the abbreviation PRN appears on a medication list. Which meaning should be recognized? Option A, by mouth. Option B, every morning. Option C, immediately. Option D, as needed. The correct answer is option D, as needed. PRN means the medication is taken as needed according to the order. By mouth is PA. Every morning is commonly abbreviated differently and is not PRN. Immediately is STAT in common medical usage. Question 97. Before the visit continues in a patient education session, a pelvic examination is scheduled. Which patient position is commonly used? Option A, Trendelenburg. Option B, lithotomy. Option C, prone. Option D, Sims. The correct answer is option B, lithotomy. The lithotomy position is commonly used for pelvic examinations. Trendelenburg places the head lower than the feet and is not the routine pelvic exam position. Prone means lying face down and is not the common pelvic exam position. Sims position is often used for rectal procedures or enemas. Question 98. As part of exam preparation in a medical office workflow, the bladder of a blood pressure cuff is not centered over the brachial artery. Which issue may occur? Option A, the patient will automatically faint. Option B, the pulse oximeter will stop working. Option C, the reading may be inaccurate. Option D, the oral temperature will decrease. The correct answer is option C, the reading may be inaccurate. Proper cuff placement over the brachial artery is needed for accurate auscultation. Incorrect cuff placement can be uncomfortable but does not automatically cause syncope. Blood pressure cuff alignment does not control the pulse oximeter. Cuff placement does not change oral temperature. Question 99. When a patient encounter unfolds in a phlebotomy station, a patient wants information released to a spouse. Which documentation is usually needed? Option A, a note written by the assistant after the fact. Option B, a valid authorization or permission according to office policy. Option C, a verbal request from the spouse only. Option D, no documentation because spouses always have full access. The correct answer is option B, a valid authorization or permission according to office policy. Disclosure to another person should follow privacy rules and documented patient permission. Authorization should come from the patient or legal authority. The spouse's request alone may not authorize release. Relationship alone does not automatically grant full access to records. Question 100. To protect safety in a women's health clinic, the provider discusses gas exchange in the lungs. Which structure is primarily responsible? Option A, ureters. Option B, alveoli. Option C, tendons. Option D, villi. The correct answer is option B, alveoli. Alveoli are tiny air sacs where oxygen and carbon dioxide are exchanged. Ureters carry urine from the kidneys to the bladder. Tendons connect muscle to bone. Villi increase absorption in the small intestine.